just like Sister Ilade has said, the purpose of today's discussion is for us to pick an organ and discuss about it and see what preventive measures we can all take so that we can remain healthy. Now, the liver is a vital organ, and no liver, no life. No heart, no life. There are some organs that are extremely vital that once they have an issue, it becomes a problem and the person has a very short time span to live. It's located in the right upper quadrant, like just under the diaphragm, and it has 500 essential functions that it performs in the body. So the liver is a very, very important organ. It's the largest organ in the body. It weighs like 1.3 kg and is responsible for our overall health. It's important in digestion, in metabolism, in our immunity as well. Now, the liver diseases, unfortunately, are often silent in the early phases of the stages of the diseases. So most of the time, people don't even know that they have a liver condition. By the time it is manifesting and they are rushing them to the hospital, or you can see the symptoms, then it has been adversely affected. Statistics have shown that over 1.2 million people die every year all over the world from liver disease, especially liver cirrhosis, liver cancer, usually predisposed by hepatitis. And most of the causes are largely preventable. Now, like I said the liver has 500 functions. I'll just mention a few. The liver is very important because it usually removes toxic byproducts from our body, especially from the medications, from the drugs we take. There's some toxic byproducts from them. The liver helps to remove that. The liver produces bile that helps us to digest some of the food that we eat, especially fats and oil. And it helps us to absorb the essential vitamins. We call them the FADEC, fat-soluble vitamins, A, D, E, K. All these are very important. If you have poor level of absorption of these vitamins, then you are prone to bleeding, especially vitamin K. It produces substances that regulate the blood clotting mechanism as well in the body. So liver produces anticoagulants. These anticoagulants prevent our blood from clotting so that you don't have venous thrombosis and all that. But it also produces what we call procoagulants that helps the blood to clot should you have an issue. So there is a very delicate balance, and the liver has to be in optimal health to be able to do this. It also helps to fight infections, remove bacteria from the blood, and it produces the proteins that we need in the body. It helps to regulate the amino acid, helps to produce a particular protein, albumin, that is responsible for maintaining the osmotic pressure in our blood system, so that we don't have things like water in the abdomen that we call ascites, which we see in those who have liver conditions that have become more serious than others. Now, the diseases of the liver are numerous. Number one is hepatitis, and it is equally preventable. Hepatitis is a precursor to all other major liver diseases. There's also liver abscess that comes from poor sanitation. There is the metabolic dysfunction, that's acute fatty liver. There's liver cirrhosis that comes from poorly treated hepatitis, liver cancer that can develop from hepatitis, and then we have other benign tumors of the liver. So we'll concentrate on one particular one that is like a precursor to all others, which is the hepatitis. Now, what is hepatitis? Hepatitis simply means inflammation of the liver. And it can be acute, it can be chronic. Acute is if this inflammation occurs and it resolves within 6 months, then it's acute. It usually will not cause any issue. But when it continues and persists for more than 6 months to 1 year, 2 years, 10 years, then it eventually destroys the liver. And it is usually caused by a virus. Now, why is hepatitis important? Statistics have shown that we have like 80 million people living with chronic hepatitis infection. 254 million people worldwide, and every year we have 1.2 million new infection every year. And we have 1.1 million people dying from this hepatitis and its sequelae every year. Majority of this death is in, or majority of this infection is in Africa. I wish you will not see the map. We have sub-Saharan Africa, Nigeria, everybody down to South Africa, having the highest number of prevalence of hepatitis in the entire world. And whereas you have the upper part of Africa, the northern African, having lower prevalence. So it is very, very important. And it is true that this thing is quite endemic in our environment. There was time when I was still in the general hospital, after a while I started telling myself that what is the problem? Almost a lot of the pregnant women who came for antenatal care were hepatitis B positive. A lot. I had to ask someone that, are they really doing this test properly? Why is everybody hepatitis positive? And that is because people are even positive without even knowing that they are positive. So a lot of them find out during the antenatal visit when we go and do viral markers for everybody, HIV stuff, they opt out. If you don't want to do it, then you now openly say you don't want to do it. But it's important because it is very, very prevalent. It is very, very endemic in our environment, and we need to take action now. Now, what are the causes of hepatitis? Basically, infection, viruses, viral hepatitis. Alcohol can cause it sometimes, medications, autoimmune disease, and metabolic disorders. So I will focus on the hepatitis. Now, the hepatitis can be hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. All of them have different sources of infection. For example, hepatitis A is fecal-oral. That means you can get hepatitis from the food you are eating, especially in places that you have overcrowding, in places with poor sanitation, places that you have fecal contamination of the water, of the food, from a person that has hepatitis. Now, the problem with hepatitis is that it doesn't die easily. It can be on this table for the next 1 week, whereas HIV, within some few minutes, it is dead. Should there be a blood splash here now, and I have an open wound, and I touch it, and I'm not vaccinated, now you've picked up hepatitis. Very easy to pick up from different areas, which we'll be talking about. Now, so for hepatitis A, it's fecal-oral. But the good thing about hepatitis A is that it doesn't cause a chronic infection. It is acute. So if somebody picks up the hepatitis, they have an acute infection, and then it clears. And to prevent it is just by pre and post immunization. Now, hepatitis B is the problem. Hepatitis B is from blood and blood products, from body fluids, vaginal fluids, semen, even sweat sometimes, depending on the level of viral load. And the route of transmission is percutaneous, meaning that you need to have an open wound or be in contact with somebody with the body fluids of someone who has hepatitis, able to get the hepatitis B. And hepatitis B causes a chronic infection. So it lasts for a lifetime, actually. Once your hepatitis B infected, it does not go. It's forever. And the same thing for hepatitis C, blood and blood products, cutaneous, it causes a chronic infection as well. And to prevent it is by screening blood donors, stop risky behaviors. And so we'll go into that, each one of them. Then hepatitis D is also blood and blood derived. It also causes a chronic infection. And hepatitis E is also fecal-oral, meaning that A and E can be gotten from the food you eat. They cause an acute infection. They clear within 6 months. But if it is that the person that gets this infection, has any other form of immunocompromisation, then it can actually kill. But most of the time, it clears off within 6 months. So for hepatitis A and E, it's just to ensure that we make sure that whatever we eat or where we are is we have safe drinking water, safe eating habits. Be careful where you eat, where you buy your mama put food. You need to be careful about that. Now, coning down on hepatitis B, which is the major culprit here. Usually, mode of transmission is from blood products. So, blood transfusion, people can get hepatitis from blood transfusion. That is why before a blood is transfused, it will usually go through a screening process in the hospital to ensure that it is free from all the viruses, hepatitis, HIV, syphilis, before we can say this blood is safe for us to transfuse to the person who requires it. Because if you require blood transfusion, that's because blood transfusion is your lifesaver. So, but before we do that, we ensure that it is safe. Then, another mode of transmission is multiple sexual partners. So, hepatitis is transmitted through sexual intercourse. And the more sexual partners you have, the higher the chances of acquiring hepatitis B and other viruses, HIV as well. It can also be through vertical transmission and then contaminated needles and syringes. Those who drug abuse users, because usually we share needles, you have to be careful. Usually we don't repeat syringes in proper hospitals. It is one use. So you use it, you discard it. Then we can also have child-to-child transmission. This is also very, very important. A child can give hepatitis B to another child. So we have to be sure that, but the way to prevent it is to ensure that we vaccinate our children. Then vertical transmission from mother to baby. So a woman is pregnant and she's not aware that she's hepatitis positive. By the time she comes into the clinic for antenatal, and she does the antenatal in a good hospital where they actually do hepatitis screening, because it's not all hospitals that will screen. Some only do HIV. But if they do the hepatitis screening, which is what we usually advocate for, and she's found to be hepatitis positive, then she needs to now do what we call the profile and the viral load. So that if she's positive, she starts medication to prevent vertical transmission to the baby. Because a lot of children who are hepatitis positive actually got it from their mom during pregnancy or during childbirth. So it's important for us to ensure that ANC is done in a clinic. Of course, manicure and pedicure using clippers, it has been advocated over and over again that if you're going to cut your hair, take your own clipper. If you're going to the salon and you're going to do manicure and pedicure, some of those cuticle removers can be sharp. It can actually pierce and it can bleed. Take your own cuticle remover. If you're going to do weave-on, buy your own needle. This is to ensure that that is used for only you. Because the fact that they rinse the cuticle, water does not rinse off hepatitis. It doesn't kill the virus. It remains there. And if it was used for someone and then used for you, you might not see this. So you can't even see them. They are viruses, very tiny. So it might still remain in all those things that are used in the barbing salon and in the hairdressing salon without you knowing, and it can be picked up from there. Then, of course, you don't share items like toothbrushes and such. I'm sure nobody does that right now. Amongst the children, though, if your child is in a boarding school, you need to also tell them you don't share sharps, don't share nail cutter, don't share blades, So we have a very high prevalence of this hepatitis in areas where, when you're barbing your hair from the malam, how they use the same blade, they just clean it with cloth, And most of the time when there is injury, it gets picked up. So they just help to distribute it very well. So you need to be careful. Body piercing, tattoo, ear piercing, when you're doing all those things, ensure that whatever it is that you're using to pierce, don't pierce. But if you want to ensure that whatever you're using in piercing is safe and it has been sterilized, very important. Now, I talked about the vertical transmission. 90% of infected infants, they eventually become chronically infected, and usually from the mother to the baby, which is why antenatal care is important. Then, of course, we also have horizontal transmission. That is usually from child to child through contaminated needles that I mentioned. Health workers also get infected too from patients and then blood transfusion. Now, how do you know that you have hepatitis? You will not know. Majority of the time, it is asymptomatic. On few occasions, the symptoms may last for a while, you know. Most of the time, number one thing that we use in detecting is when the patient complains and then the patient comes in jaundiced. So jaundice, fever, jaundice means yellowness of the eyes, okay, and other mucous membrane. And that is because the liver is so overwhelmed, it cannot clear away that bilirubin that causes the physical manifestation of jaundice. So then loss of appetite, gastrointestinal problem, abdominal pain, all those ones are short-lived in the acute stage of the infection. Eventually, hepatitis becomes chronic. Once infected with hepatitis B and C, it remains in the body. Even when you now take medication, it's just like HIV, it doesn't go, but it can reduce the viral load to an undetectable level. Now, usually, how do we investigate? First, of course, we take history, we examine, and then from ultrasound scan and blood test. Ultrasound scan, especially if you have an enlarged liver, we'll be able to see it on scan. Blood test to liver function test, then of course the viral markers. And treatments for hepatitis. If hepatitis continues and it becomes chronic, eventually it can lead to liver failure. And once there is liver failure, the only treatment for liver failure is liver transplant, which we don't even do here in Nigeria. And if there is no liver transplant, it's just a matter of time before the person eventually dies, which is why it's important to ensure, but it is preventable if we take proper precautions. Now, if it is that someone is hepatitis positive, there is no need to raise an alarm. What you need to do is to ensure that you get to a good hospital, a teaching hospital, and see a gastroenterologist. There are medications that can be given depending on what hepatitis we are looking at, what level, based on your history and examination, and some other tests that will be done. The medication that might be given that can reduce the viral load of the hepatitis virus to a level where it is, if you take the medications, just like HIV, if you take HIV medications regularly, the way you're supposed to, it reduces the viral load so that the HIV does not destroy your immune system. The same thing for hepatitis. There are medications that can be given to reduce the viral load such that the effect on the liver can be reduced and it will not cause eventual liver failure. However, if it is that the person does not know and eventually the liver fails, then liver transplant is what is required to keep that person alive. Now, how do we prevent it? Highly preventable. Don't assume that you are immune. There are vaccines that can be given to prevent hepatitis. Now, usually, once we give birth to children now, we give them vaccine, except you don't take your child for vaccination. But it is included in the national immunization schedule to give the children 4 doses of hepatitis vaccine at birth, immediately after birth. Even if the mother is hepatitis positive, what we usually advocate is that the mother does not breastfeed until we immunize that baby, because hepatitis can also be secreted in the breast milk. So we'll immunize the baby first, then once baby develops immunity, can breastfeed. So we give the babies immunization at birth, at 6 weeks, 10 weeks, and 14 weeks. And that makes them immune. Now, there's usually now an adult dose, a booster dose that we also give to adults. When I was in med school, by the time we were starting clinicals, they told all of us to go and get vaccinated. The dose is you take 3 doses as an adult. The first dose at the time of taking, then the second dose 1 month after, and then the third dose 6 months after, and then you are immune. So that even if you come across the hepatitis virus, it doesn't get, you don't get infected by it. When we were taking the dose, I took the first one, took the 1 month after, and then I forgot. I now remembered like a year or two later, and I went back. They said, no, you have to start again. So I started again, took the first dose, took the 1 month, then school, I forgot again. By the time I remembered, they said you have to, I was like, is it only me? Why am I taking 3 doses? So the last one I took, I think I took it maybe like 6 years ago. That was when I was able to complete my 3 doses. Took the first one, and I was following myself up so that I don't forget. So it's because if you do not complete your dose, you're not actually immune. You can be, and most of the time, because we're medical personnel, we deal with a lot of patients that have hepatitis. Because somebody has hepatitis or HIV, doesn't mean that you will not touch them or treat them. What is important is that you get vaccinated, and we can all get vaccinated. Now, you don't get vaccinated if you are already hepatitis B positive. What you need to do if you are positive already is to get treated. But if you do your hepatitis B test, which can be done in any good lab, if you do it, and so if you go to the lab and say you want to do your viral markers, they will do hepatitis B, hepatitis C, HIV-1, HIV-2, syphilis, they will do the viral markers. If your hepatitis B is positive, then you get treated. If you are negative, then you get your immunization as an adult, the booster dose, and complete it, then you are safe. The fact that, because we also have a lot of serodiscordant couples, that means that you can have husband positive, wife negative, husband positive. So once we get that in the clinic, what we usually advise the negative spouse to do is to get vaccinated at that point in time. And if she takes her dose 1 month after, the second dose, and 6 months after, and she develops immunity to it, then she's safe. Even if they have sexual intercourse, she's no longer going to be able to acquire that hepatitis infection, which is why the immunization is very, very important. There's somebody I know who, as far back as maybe 20 years ago, found out that he was hepatitis positive, and I think he didn't treat it well. Just last year, he decompensated into decompensated liver cirrhosis. In fact, we even thought he was going to die because it was really, really bad. We had ascites everywhere. The liver was not functioning. It was jaundiced, So right now, person is still on treatment. We're still watching. But if hepatitis is not treated and the viral load is continuously high, it will damage the liver. And when it does that, then liver transplant. So please, it's important that we get the immunized or get treated. Now, what are the preventive measures again? First, all pregnant women should be screened for hepatitis B virus infection, and appropriate measures taken to prevent vertical transmission to the baby. 2, let's vaccinate all our children. If you are not sure whether you were vaccinated as a child, please go and take the adult. It's available, health centers everywhere, general hospitals. Just walk in, and it's not expensive. So let's all get vaccinated, please. Then, of course, female children should not be circumcised. If you're going to circumcise your male child, make sure that it is in a hospital where they have sterilized instruments. Don't forget that I said hepatitis does not die on time. So then, of course, tribal marks, ear piercing, tattoos, let's do it in a place where they use sterilized instruments. Injection safety, do not share blades. Then premarital counseling. It's important for us to include, so most of the time, premarital counseling is usually just for HIV and pregnancy tests. I think you should include hepatitis in it, so that before the girl gets into it or the boy gets into it, they know what they're getting into. If your spouse or your partner-to-be is hepatitis positive, it doesn't mean that you need to now go and look for another boyfriend or another girlfriend. Just get immunized before you get infected. As simple as that. So you should be encouraging our premarital counseling and screening as well. And of course, fidelity should be encouraged in marriage. A couple might be negative, negative, and then if one spouse becomes promiscuous, might go out and bring home the hepatitis virus. And once infected, is a lifetime thing. So let's try and be faithful to our partners, to one partner. Now, apart from hepatitis, there are other important causes that damage the liver, important practices or social lifestyle that damages the liver, and that is alcohol. Alcohol damages the liver. The amount of alcohol in the drinks we consume vary. Palm wine contains 2%, beer 5%, wine varies, and then all those our hardcore gin and shepe and stuff like that, eventually it will lead to damage of the liver. If you take one bottle of beer per day and every day for the next 5 years, you can be almost 90% sure that you will come down with a liver disease in the next 5 years, because one bottle of beer contains like 33 grams of alcohol. That is enough to damage the liver. One beer of bottle per day for the next 5 years, liver failure in the next 5 years. So please, let's be careful. Now, another thing that damages the liver are our herbs and drugs. Agbo major. You don't even know what is inside the agbo. And the agbo is usually prepared with gin or some really hard liquor. Let's watch the amount of agbo that we drink. Some people, if you don't drink agbo in the morning, they are not okay. Eventually, it will lead to liver damage. You don't even know, so you don't know the content of what you are drinking. You don't know the percentage of these things that are in it. Because the liver metabolizes almost everything that you take in. It detoxifies, it metabolizes. So everything passes through this one liver, this one organ. And you've had drug-induced liver damages occurring. So even some of the medications, so when we're giving medications, sometimes you can hear that if you read the back of some antibiotics, they will say it is hepatotoxic, renotoxic, meaning that large dose of that medication can destroy the liver. Paracetamol, alabukun, all those things that you are taking, I have pain. In fact, this person I know, I think he must have been NSAIDs that decompensated that liver, apart from the fact that he has hepatitis. Because every time when he complains of pain, before you know it, they take medications. Overdose of paracetamol shuts down the liver, as in like that. So simple medications, pain relief, NSAIDs, most of them are hepatotoxic. That is why you don't take too much at a time, and you don't take it for a prolonged time. You can't be taking paracetamol every day. What is the problem? What is the pain? Why are you having headache? You need to treat the underlying cause of that pain or headache or whatever it is that you're using that pain relief for. Pain medications are for a short time. You take it to treat the cause, and then after you stop. So we need to be careful the drugs that we take and the herbs that we drink, because they can be hepatotoxic. Now, another thing is aflatoxin. It's inside the food we eat. So you buy corn, and you know when the corn is almost looking spoiled or looking moldy, and then you just wash it and cook it. Cooking does not kill aflatoxin. Frying granuts, the nuts that we take. So you have a large amount of aflatoxins in our grains. In fact, WHO declared aflatoxin a global food security concern. If you take it, in fact, evidence abounds that many of our staple foods in Nigeria contain aflatoxin concentration far above the safety limit. So massive exposure to aflatoxin within a short period leads to liver injury. It's in the granules that we eat. It's in the corn that we eat. Whether you are cooking it or you are frying it, it doesn't eliminate it completely. It reduces it, but it does not eliminate it. So if it is that, when they fry the granules, because of gain, when you see a granite bottle, you can see those black ones, those small spot ones. But they will put everything inside, because if they remove it, it will reduce the amount of granite in the bottle. So it is less for you. So some of us will just take it. You are working, you are eating everything together. Eating everything together. Please, let's stop that habit. Look at what you are eating. If it looks that it's not healthy, throw away that granite. You can even buy a bottle of granite, take it back home, sort it out yourself. You see that it's maybe 3/4 of the bottle that will be left. And then you can refry it and then now consume. But continuous or large consumption of these things can actually damage the liver over a long period of time. So we need to be careful. Peanuts, butter, even our black pepper, turmeric, coriander, ginger. So what will we eat? So what it means is that before you put in your mouth, open your eyes. Look at all those things. When you cook it or you fry it, heat does not kill it, but it reduces it. And then what is even advocated, this aflatoxin problem will come from the farmer, them using proper grains in the first place, and then our own storage, even rice. So when you have all these things, once it is spoiled, try not to eat it. Even though I know somebody who, when he's looking spoiled, he will want meat. and then so he did it one time. I ended up in the hospital. Apart from he ended up getting food poison. So we need to be careful about what we eat. It's very important, because what we take in and our social practices are what results into all this injury. It doesn't drop. Liver disease does not drop from heaven. It is what we do. So we need to be careful. Now, for those, so another important point is that those who are already hepatitis B positive and they consume large amount of this aflatoxin contaminated food, they have a 30% chance of developing liver failure. 30%. So they have to be careful. Now, in conclusion, what's our take-home message? First, I'm going to repeat, repetition makes for emphasis. Avoid the use of unprescribed drugs. Stop self-medication, because you don't know what medication that you're taking. Everybody is taking Ampiclox, so the Ampiclox is not working again. Be careful the medications you take. Self-prescribed drugs can actually damage organs in your body without you knowing. 2, avoid alcohol. If you are going to take it in moderation, because continuous use over a long period of time would definitely, it's like you've just declared your own pathway to liver failure. 2, avoid smoking. 3, 4, check your hepatitis B status. It's okay to walk. I'm emphasizing it because we will say it here now, people will not do it. It's okay to walk into a lab and check. It won't take you so much, it's not costing so much. But let us all check our viral status, hepatitis B, hepatitis C, HIV1, HIV2, so that there are medications for it to prevent all these damages. Then, of course, for our pregnant women, let's ensure that ANC is done in a good place so that we prevent vertical transmission to the child. And vaccinate all children as well. All right? And then ensure regular exercise, balanced diet. All these things are good for the body. They help the liver as well. That will be all. Thank you very much.
Let's appreciate that one more time. We've been properly educated, and the summary is that we have duties. Our health is actually our responsibility. It's in our hand. And it's better not to have the disease than to be looking